How to identify Medicare fraud and abuse. Have you ever wondered how to spot Medicare fraud and abuse? It's a serious issue that affects many beneficiaries and the overall healthcare system. Let's break down how you can identify these problems effectively. Medicare fraud involves actions that lead to improper payments from the Medicare program. This can include knowingly submitting false claims. For example, billing for services that were never provided or charging for a higher level of service than what was actually delivered. This practice is known as upcoding. Another form of fraud is billing for appointments that the patient did not attend. Abuse, on the other hand, refers to practices that result in unnecessary costs to Medicare. This can happen when billing codes are misused or when services that are not medically necessary are provided. So, what are some signs that you might be dealing with fraud or abuse? Look out for claims for services that seem unrelated to the patient's condition. If you see billing for services that are more complex than what is documented, that could be a red flag. Frequent billing for the same service or billing for services when the patient was not present are also concerning signs. Providers charging for services outside their specialty or showing unusual patterns of referrals can indicate kickbacks. These patterns can suggest that something is not right with the billing practices. Medicare employs various methods to detect fraud and abuse. They use predictive analytics and data mining techniques to analyze large sets of claims data. These tools help identify suspicious patterns. For instance, advanced algorithms can compare treatment patterns to what is typical in medical practice. This helps flag anomalies, like expensive surgeries billed for conditions that usually do not requiring them. The Centers for Medicare and Medicaid Services operates a fraud prevention system that applies these analytics to Medicare fee-for-service claims before payment. This helps catch potentially suspicious claims early. Healthcare inspectors and auditors also play a role in uncovering fraud. They review claims and provider activities, looking for inconsistencies or false statements in applications related to Medicare participation. As a Medicare beneficiary or provider, you can take steps to help identify fraud and abuse. Start by reviewing your Medicare summary notices carefully. Make sure all billed services were actually received. If you notice any suspicious billing or services, report them to Medicare or the Office of Inspector General. Be cautious about unsolicited offers for medical equipment or services. It's important to avoid sharing your Medicare number except with trusted providers. By understanding these key points, you can help protect the Medicare program and ensure that resources are used appropriately for those who need them.